The recorded started. Okay, there it goes. All right, y'all. Again, welcoming everybody to the fall 2025 EXL Academy, increasing access to mental health through expanded learning. Some of today's agenda, we just came from our welcome. We're going to begin our workshop session soon. At 11:25, we'll have closing comments, 11:35, interactive breakout sessions, and at 12, our workshop ends, and so does the Zoom. So when you're in your breakout rooms, we won't be coming back to the main space. You'll just kind of end in the breakout spaces. All right, so a reminder that this is a shared learning space. We hold our workshop as shared learning and collaborative spaces, and we update our materials in the fly as needed. Know that a learning guide and resources link will be dropped in the chat, but that's for you. It's a Google Doc. It helps you collect, important notes. And it helps also, we can't really download the chat, so you can add any like ideas that come from the chat in this specific location on our learning guide. A reminder that a PDF presentation is linked in the learning guide for reference, but the presentation will be updated after the workshop and will be added to our website within 24 hours after the workshop, along with the workshop recording. So you will get that recording. Please note for chat support, please direct any messages to Nat Rosales, hey Nat, and not the presenters, right? They're going to be busy presenting, as they will not respond to the chat. All right. Let's see what's a really quick, just honoring a recap of all of our fall academies. We started with workshop 1 on the 16th with nuts and bolts, the latest updates supporting quality EXL programs, and we give thanks to everybody who contributed to that space. Workshop 2, September 18th, was shining the light on quality expanded learning, celebrating and communicating impact, giving a shout out to all the beautiful people that were a part of that space. And workshop 3 was September 30th, Beyond the Now, Strategic Partnerships for Sustainable EXL Programs. That was yesterday. It was great. And so honoring all the beautiful people that contributed to that space. All right, breakout. So after we're done with the workshop, talking part of things, we're going to move into breakouts, and it's kind of choose your own adventure. Some things to note that these are informal discussion spaces, not many presentations. So in this space, you want to bring your questions, your ahas, anything that popped up for you as you were listening to the talks, and a reminder that this will not be recorded. It's also a great opportunity to use your learning guide, as you may have written down some important notes there and you want to bring them back out for deeper discussion in these spaces. A reminder of the breakout room configurations. Room 1 would be program quality and conditions for learning, and that will be with Jeff. What's up, Jeff? Room 2, more about CYBHI wellness coaches with Donielle. Hey, Donielle. Room 3, learning from our LEA example with Modesto City School District with Araceli and Liz. Welcome, and thank you for being here. And then room 4, school-based mental health as part of a broader ecosystem initiative with me, Vanessa. All right, and introducing our presenters today. So we got Donielle Prince, who is our Senior Specialist for Equity and Quality for the California After School Network. We got Jeff, our Executive Director for the California After School Network. Araceli Corral, which is a Director 1 for Student Support Services for Modesto City School District. And Liz Elizondo, Youth Services Program Director for the Center for Human Services. Welcome. Today's workshop, I should say, will focus on expanded learning that creates the conditions for thriving, expanded learning as a platform for school-based mental health. We'll have an LEA example from Modesto City Schools, recommendations for expanded learning programs, and opportunities for you to reflect and offer questions that could potentially be addressed in this session. And without further ado, handing it over to Donielle. Thank you.
Okay, good morning, everyone. And thank you, Vanessa, for that very warm welcome and helping us get ready for our learning today. I'm going to get us started by understanding the context of how expanded learning already serves the mission to support young people's overall mental and emotional well-being. So how expanded learning creates the conditions for thriving. And we'll look at the next slide. And just throughout today's academy, you're going to hear about what you can see there on the slide. We're going to talk about strategies to braid a new California youth. I always say California Children and Youth Behavioral Health Initiative resource, the statewide multi-payer fee schedule, and other funding sources like the LEA billing option, and to use these resources with expanded learning, which is another ongoing funding source. We'll talk about strategies for braiding resources to sustain these programs. We'll talk about what it means to certify your existing expanded learning staff as wellness coaches and design strategies that will integrate that newly certified wellness coach activities with the programming you're already doing in expanded learning. We'll also talk about how to increase young people's access to school-based health and mental health initiatives all day, all year by co-locating services with the expanded learning program. So making expanded learning a partner with the school day. We'll spend some time talking about leveraging expanded learning programs as a platform to inform, I know most people here have heard about the Children and Youth Behavioral Health Initiative, but there's many components to it. Not everyone knows what it is, and we need ways of helping the community itself, the young people and their families to understand and what those services could mean. And so expanded learning is already well positioned to help with that communication, messaging, and connection, as well as there's many resources that the CYBHI initiative is also designing to support mental health services directly. And so to also use expanded learning programs as a way to make sure families know about those resources. And finally, we will spend some time talking about shaping the future of education, health, and human services in that ecosystem that you were just imagining with Vanessa. And hoping that many of the people here will join the ecosystem advisory team towards this goal of integrating our work across an ecosystem and getting out of the silos. All right, and we'll go to the next slide. So this morning we'll explore the role of expanded learning as part of an integrated education, health, and human services ecosystem, and how this connects to the opportunity to increase the access that young people have to mental health supports, which is the explicit goal of the CYBHI initiative. And we'll go to the next slide. This idea of working across initiatives is well captured from this graphic from the California Department of Education, the Transforming Schools initiative. It shows the vision of bringing together initiatives and programming to work together and collectively to help meet the conditions that young people need for thriving. So you can see on your screen this graphic, and I'll just start with that yellow piece: universal meals, universal pre-K, community schools, and I need to make it bigger so I can read it. Um, Partnering with Indigenous communities, professional learning, anti-bias education, mental health programs, and expanded learning programs are a part of that vision. And we'll go to the next slide. So today we're going to talk about this integration overall, and we're also going to focus on the ways that expanded learning connects with the Children and Youth Behavioral Health Initiative, CYBHI, which has the core goal of increasing young people's access to mental and behavioral health services. The CYBHI initiative holds integration with the whole child in mind as it's part of its guiding principles. And the ecosystem right there in the guiding principles for that initiative um, is a they use the ecosystem as a reference for this vision of integrating across systems with the value of being youth-centered with equity at the foundation. You can go to the next slide. When considering how expanded learning supports young people's thriving, it's helpful to understand that the roots of expanded learning are grounded in the literature on resilience and positive youth development. So, at its very origin, expanded learning is rooted in a research-based approaches for how you best meet young people's needs. We'll take a look at the next slide. Positive youth development research helps us understand the connection between meeting young people's developmental needs and how this contributes to their individual thriving, as both as they grow, as they're growing, and also towards the outcomes that we would hope to see for them in their future. So this graphic just kind of shows us youth, as it's titled, Youth Development and Process. This is how it works. It's connected to what we understand about what's best for human beings across the developmental lifespan, with a particular focus on what we need for youth to thrive. And expanded learning programs were designed with this research in mind and at its core. So we'll go to the next slide. Um, and so when I say expanded learning programs were designed with positive youth development in mind, that's actually reflected in the quality standards that many of you here are familiar with, the quality standards for expanded learning in California. Um, Expanded learning programs are highly aligned with the research based on youth development. And as you can see on this slide, just in the italics, high quality programs create conditions that support positive developmental outcomes consistent with the science of learning and development. So this is at the core of the programs. And next we'll look at how the standards, you can see on your screen types of quality standards. So you can, one way to think about all of the standards is in two buckets. So the point of service, the standards that reflect the activities that are designed for young people, and ensuring that those activities are consistent with what we know about positive youth development, as well as the structural level of the program design. So when thinking about how to develop the program, ensuring that there's quality staff, the clear vision, collaborative partnership, continuous quality improvement is part of the process, thinking about program management and ongoing sustainability, which is part of what we're going to talk about in connection with the resources from CYBHI. Um, and next slide. Um, this connection between the research, program design, and positive outcomes for youth could also be simplified as love is a research-based approach. And the idea behind that is just when you dig into that positive youth development research, you see it really is synonymous with what it means to care about a young person. Next slide. And just a word about the nature of expanded learning staff. In addition to the overall program quality, expanded learning staff tend to reflect the diversity of California, which is also the diversity of the student population in each of the schools they serve. We'll go to the next slide. And just in thinking about the overall goal of the structural sustainability of expanded learning, just to highlight, many know this, but if expanded learning is a funded part of the California Department of Education's Education Code, offering opportunities for young people to be served before school, after school, and other out of school time, like at summer and intersession. Expanded learning is intended to meet the needs of the whole child. So it's designed, again, if it's designed with positive youth development in mind, that means it's designed with the whole child in mind. So the programming that is expected will address all domains of thriving. So that includes academic, but also the social, emotional, and physical well-being of young people. And all of the activities, of course, reflect positive youth development. And then we'll go to the next slide. Part of when you're thinking about the sustainability and structural support of expanded learning, it includes a system of support for expanded learning. It's supported by the Expanded Learning Division in the California Department of Education and that staff. It's supported by 16 county offices of education with designated county leads and staff, including for the STEAM Hub. There's also 2 statewide technical assistance providers, which include ASAP Connect and California After School Network. So there's a lot of support. When you saw those standards, it's not just something that's on paper and people start a program and it's on paper and never thought of again, but it's actively supported in many ways, including training on those standards. So on the next slide, and again, as we're talking about sustainability, just at a glance, you can see here for fiscal year 25-26, expanded learning is funded through the state budget. So the expanded learning funds, the ELLP funds are there in green. Well, we'll see on the next slide, but we'll stay here for a second. The expanded learning was introduced in 2021, adding to the prior funding that you can see on the left in orange for the state ACES after school program and the federally funded 21st Century Learning Center funding. So you can see just in looking at this one slide that California has made a very significant ongoing commitment into the importance of expanded learning. And it makes it a great partner for all of these initiatives to intersect to help meet the needs of young people. And so next slide. And so this is just a look at this, just to make that point about the commitment California has made. This is a look at the funding over time that from those same funding streams I just mentioned, and it highlights the strength of California's commitment to ongoing funding of expanded learning, making expanded learning an important partner in the goal to create spaces and opportunities for young people to access mental and emotional well-being services and support. And so with that, I'm going to turn it over to Jeff, who will talk about expanded learning as a platform for school-based mental health.
Thank you, Donielle. And just to sort of give folks an indication of sort of where you are in the journey, we're going to strengthen the context for expanded learning now, right? As a platform for school-based mental health. That means we're going to learn a little bit more about the intersection of multiple programs, and we're going to learn about this new opportunity of wellness coaches and school-based mental health funding through the statewide multi-payer fee schedule that is increasing access to school-based mental health, and explore a little bit about why a district would want to partner with expanded learning to offer that. Then we're going to have an opportunity to reflect a little bit on that. And then we're going to hear of an example before we hear even further recommendations for expanded learning toward the end of this session here. So that's where we are in our journey. Not now, but in a moment, we're going to get a chance to see a lot of imagery. But what we did just see was that expanded learning is a robust, scalable platform grounded in positive youth development and is sort of based on its scale and investment, a real platform for a lot of different kinds of partnerships. And when we look at a lot of the investments that California has made and what is their intended purpose through a whole child lens, in a moment, we'll get a chance to sort of see some data that was generated in a report called, if we could still go back a little bit, I'll let you know, um, in strengthening coherence across initiatives, a whole child lens. You can see that all of those elements where we were talking about program quality are outlined in these 5 principles surfaced by the Learning Policy Institute around how to support whole child design. So when we look at a variety of investments in the expanded learning space, we're going to just sort of move through these next slides, and you'll sort of get this visual representation. So if we could see the next slide, um, you see that at the bottom of this slide, you see a lot of investments: community schools, expanded learning, multi-tiered systems of support, positive behavior interventions and support, and CalHope SEL. And if you look here at this one, right, in a lot of ways, expanded learning holds and literally could be a platform for all of these investments. Now let's just sort of move through each of these different domains and just sort of take a look. So if we could see the next slide and the next slide and the next slide and the next one. Um, and finally, the next one. So if you sort of get this sense, right, there is this takeaway that there's so many complementary goals in multiple of the investments that were made. And if we could just go ahead and rest on the next slide for a moment, sort of what I'll share a little bit about is even though theoretically many of these investments are coherent, and even though we have multiple state visions, including the one in transforming schools and the one presented by the Children and Youth Behavioral Health Initiative, um, both of these are really looking at shifting the way that we work so that we can be more integrated in the way that we do that. But we are now sort of plinkoing a lot of these new investments into systems that have been historically siloed. And so, what we're really needing to do at our local and regional levels is start to think about how we shift uh, our structures in order to be able to actually accomplish this vision of integration. And one of the ecological concept, you hear us talk about the ecosystem plan for expanded learning. One of the ecological concepts that we're really leaning into and thinking that there's a lot of benefit in considering is this concept of ecotone. And when we think about ecotone, it is really where two ecosystems meet, right? I'm here in Sacramento, and we've got the valley that goes sort of up the hill into an oak woodland ecosystem, and then you get into the mountains and into a conifer forest. And each of those places where one system is giving way to the next system, where they touch, you have all the critters from each of those systems in the same place. This is the richness of biodiversity where these two ecosystems touch. And if we think about arranging our human systems, instead of what I would sort of outline our silos now as agricultural monocultures, but if we intentionally structured them like ecotones, what we would find is that there's a lot of overlapping investment and shared goal that we might be able to sort of merge together and generate abundance, as opposed to keeping each of these initiatives separate, which can really seek to perpetuate scarcity. So, moving into our next slide, some of the context with the Children and Youth Behavioral Health Initiative is that this is really a goal of creating access through billing, not only Medi-Cal, but also managed care plans to create access for all students to school-based mental health. So this is a really exciting opportunity that California is launching. It's emerging, and the funding structure is called the statewide multi-payer fee schedule. And if we could move to the next slide, there are multiple sort of working streams of the Children and Youth Behavioral Health Initiative. One includes the capacity grants. So at your local county office of ed, there is somebody that is working to build all of the district capacity around how to access this new funding and billing structure in order to create access to these services. And districts are also participating in cohorts to learn this as well. So you might be a community-based organization partner with expanded learning and thinking, oh, maybe I need to talk to my district. Or you might be a district that's wondering how can I sort of create this partnership perhaps you'd want to think about looking into your local county office of ed capacity grant structure. Next slide, please. Um, and the other component, and as we're going to see on the next slide, is this opportunity around wellness coaches. And wellness coaches are a brand new workforce. And quite honestly, when I heard about the launch of wellness coaches, um, I had said to the agency called Healthcare Access and Information, or HCI, wow, I think you have thousands of these folks on school campuses today, right now, before the workforce was ever created. But these are folks that are going to promote physical wellness. They're going to promote social emotional wellness, and they're going to provide non-clinical supports like screening, navigation to services. So a lot of the things that wellness coaches would do would be consistent with the practices that already happen in expanded learning programs. So we're thinking about how to bring that together. So this caused us to sort of ask some questions. And on the next slide, the real guiding question that we had and that we've been exploring is, what if expanded learning was a time and place to provide school-based mental health and health services to kids? What if this was the platform or a platform to increase access? We also sort of said, then how does that happen? So what if expanded learning funded was braided with school-based mental health funding as a concrete strategy to accomplish a lot of district goals that exist right now? These might include, how do we sustain our community school efforts? Many folks may be wondering, what the future looks like when reductions in multi-tiered systems of support at the state level come into play. Well, these new sort of sun rising funding sources, expanded learning and the statewide multi-payer fee schedule, might be some things to leverage to make sure that some of those access and services still can be sustained. And just a little bit about why a district and expanded learning program partnership might be beneficial. We can take a look at that on the next slide. And really, what this means then is this type of partnership, one, can make sure that a student doesn't have to lose access to instruction in order to access the services that they need. Oftentimes, there's a challenge, especially with clinical services. How do that are accessed through the school? How do those get access through the summer? Well, leveraging the 30 non-school days and 9 hours in the summer, right, is a strategy to make sure that we can increase that access. Um, and then there's a different vibe in expanded learning. It's a little bit different that if you are getting access to a clinical experience, um, that what you come into after that, right? You might be feeling ways, but coming into a place where there might be a snack available or multiple enrichment opportunities available is a different sort of space to enter than to come out of a clinical experience and go into math class. And then this also is a way to write. One of the things that we hear in the school-based mental health world is, well, in order to sustain access to these services, we need a critical mass of what are called billable encounters so that we can sustain, right, the role of that clinician. Um, well, what if you had 3 extra hours each day, 5 hours on an early release day, and 9 hours on 30 days in intercession and in the summer, all throughout the year, right, to generate those kinds of billable encounters. And not only that, you have access to more geographical space. Oftentimes, a school during the school day might have only one literally physical space, a room where a private clinical encounter can take place. But when teachers and students vacate the classrooms, then there are multiple places where this can happen. Um, so, what we had intended to do at this point in time was offer you dedicated time to offer some reflection in the Padlet. I'm going to ask my team to drop in the Padlet. And if folks want to offer any reflections they're having at this time, and especially considering that what are you wondering part, um, you are free to access that Padlet now. And on the back end, I'll especially be looking at that. What are you wondering about? And see if we might be able to address any of the questions that you have. But for the sake of time and for the sake of really getting to the heart of this workshop, just wanting to transition to welcoming um, Araceli Corral and Liz Elizondo um, from Modesto City Schools and their community partner, and just learn a little bit about sort of what this can look like on the ground in an actual school district. So, welcoming our speakers, and thank you so much for sharing your wisdom with us today.
Thank you, Jeff. Thank you so much. I just love being on these calls. It just really resonates. I've been in expanded learning with the good old days of just having ACEs in our district, to now having ELOP has really made a difference in the ability to braid a lot of the funding sources that we'll be talking about. My name is Araceli Corral, Director in Student Support Services with Modesto City Schools. And today with me, I have the one and only.
Hi, I'm Liz Elizondo. I'm the Youth Services Program Director within Center for Human Services, local nonprofit within Stanislaus County.
And this is one of our main partners here in our district. So just wanted to highlight the work that we're doing with the Center for Human Services through Modesto City Schools. So the purpose of today's presentation, so the next slide, it's really about discussing what we are doing here in our district, the school-based partnerships that we have, the multiple funding sources and opportunities. And then I do have a little matrix that gives us a visual of the many funding sources that we're using to leverage and really braid to bring really access to mental health through expanded learning in our district. And then some of the next steps that we're currently working on locally as well. The next slide will also, it's really just our district vision. So our vision is really for every student to truly graduate with the skills, knowledge, and character traits essential to thrive and contribute to society. So the work that we do in our district through expanded learning, we really tie it back to the district vision. The next slide is this. These are some of the questions that we really started to ponder and really think about as the ESSER funds were expiring. We really talked about internally what are the educational providers in your area that would provide mental health supports. After a lot of the ESSER funds expired, we started to look at, okay, what are we going to lose? How do we sustain the programs that we currently have? And really talked about next steps that we can take to maintain the services that we had after losing some of our funding with the ESSER funds. So the next slide will really cover some of the school-based partners that we have. As mentioned a few minutes ago, Liz Elizondo is the Director for Center for Human Services, and we really work closely together to bring a lot of the supports to our school sites. We have, through her organization, we bring in the student assistant specialist, which we'll talk in a little bit about what that looks like. But I do want to highlight that a lot of the support services that we offer, especially in the 30 non-instructional days, as Jeff was mentioning earlier, we really leverage our funding to bring the student assistant specialist into our 30 non-instructional days to provide the ongoing supports for our young people. And we also have Sierra Vista Child and Family Services mentoring programs that we leverage and bring after school and during the day. We also leverage our BCBAs. So our BCBAs support during the day, and then we leverage them after school. So that's also a really important role for our staff, school counselors, paraeducators. But before I move on to the next slide, I really want to just highlight that in our district, the organizational structure has really created the conditions to be able to leverage and braid all of our funds. So in Modesto City Schools, expanded learning is under the umbrella of student support services. And in essence, we're truly all in one building. So in our building, we really have our SELPA, we have health services, we have a variety of support. The student support services is everyone's in one building. So it's so nice and easy to just kind of walk down the doors here and talk to our colleagues to see how we can better support our young people and how do we continue to leverage all these funds that we have in the different departments and do some cost sharing to ensure that we're sustaining the programs that we have. Next slide, please. And again, Liz is definitely our guru for Center for Human Services.
Thanks, Araceli. So yes, Center for Human Services, just a little bit of background, local nonprofit focused on community counseling. We have had a partnership with Modesto City Schools for over 30 years. I've been in the business for over 55 years, so just a little bit about how long we've been doing this work. And then we're really instrumental in providing the following to Modesto City Schools is that social emotional support for students, doing consultation or professional development for staff, and parent trainings, and happening both in the school day, but also during the after school time. So next slide. So Student Assistance Specialist is probably one of the the bigger programs in which we're able to do that work. I oversee the Student Assistance Specialist, and the next slide will also show Family Support Specialist, but just for the context of this work, we're really providing service on social emotional learning for students throughout all grade levels, so TK through 12, and recognizing that behaviors are not just occurring during the school day, but also after school or when school is not in the traditional setting, but during like those summer school times. And so really being able to help that child, we talked about whole child approach earlier, being able to meet that child where they're at, no matter where they're at in their school day, and being able to utilize the partnership to continue doing that work. And it's not just in one-on-one with students, but also through the parent aspect of having these presentations where we're talking about what that means to work with students one-on-one on different coping skills. We're really that step before counseling, but also understanding what that means and what other supports are available to students on campus so that we're connecting them based on where they're at. And so along with that, Jeff was talking about certified wellness coaches, being that we have been doing this work specifically for the student assistance program for over 40 years. And so having a little bit of knowledge, I'll say a little bit being modest, but having some knowledge in what that entails in terms of student population, what the goal is, and that a lot of that work aligned. You talked about Ecotone, and I just thought that is how we are working with our Modesto City School partner in meeting the need, not just during the school day, but also during the after school as the mental health partner, and learning what that means for our folks. So the work that our student assistance specialists are doing is work that we've been doing for quite some time, and the certification really allows us to be able to continue that work for billable services. Next slide. We also have family support specialists, and so this is more centered around the family, recognizing that there may be some barriers or challenges that the families are experiencing, and so really focusing on those families and providing community supports, parenting classes, looking for what their basic needs may or what barriers they may have in order to have their child be connected to the school that's impactful, ultimately working towards that goal of helping the student to be well, and knowing that that may take some resources. So a lot of cross collaboration with Modesto City Schools, as well as internal resources and other partners throughout Stanislaus County. Next slide. And then we have our integrated mental health clinicians. So that next level of care. So if they are not within that prevention type realm, what does that look like if they need a higher level of care? And so we also have mental health clinicians that are at all of the school sites throughout Modesto City Schools, which is great. And using this braided funding model so that there is not a barrier to service for that student. That could be either for a billable service or just that it's identified as a need for the student. And so still connecting them to those clinicians on campus and doing some of the other work through presentations and training for staff and parents. Next slide. And I'm going to pass it back over to Araceli.
Thank you, Liz. And another partner that we also have is Sierra Vista Child and Family Services Mentoring. We have a mentoring program and a contract with Sierra Vista. And again, it's a nonprofit here in town. They provide one-on-one volunteer mentoring at some elementary sites, but not only during the day. They also stay and do some work with expanded learning. And we're really targeted 8 highest needs elementaries currently. But again, all these services are not only happening during the day, but also during expanded learning time, till 6 o'clock at times. Next slide. The BCBAs. So again, we also leverage on our BCBAs for the district. They assist the teachers during the day and other staff, our expanded learning staff, with strategies to support students. So again, we tap into our BCBAs that can stay after school hours and support our staff, provide some professional development on classroom management for all of our frontline staff, and really support the PBIS and restorative practices in and outside of the classroom. Next slide. And I'm just going to also mention that we also work closely with our school counselors in the 7th and 12th grades here in our district, and really just tapping into the college counselors. How do we then leverage our counselors to support after school and continue that college to career pathways with expanded learning? And we also tap into our EL counselors to see how we can support our EL learners. And again, all this is part of some next steps that we're also working on in our district. Next slide. And again, Modesto City Schools, we have a lot of paraprofessionals that work in our program. We have autism paraprofessionals, TK educators, MTSS, paras, and currently a lot of our 5 and 6 hour positions, a lot of our paras that work 5 or 6 hours during the day. In expanded learning, we have the ability to appoint for additional 2 or 3 hours. That makes an employee become an 8-hour position employee. So that's really, it's been very helpful to our programs as well. Next slide. And here I'm just going to kind of skim through some of the funding sources that we leverage. The next slide will definitely talk about the different funding sources that we leverage. So again, we have ELOP, we have our ACES-based grants, our ELOP, some learning communities for school success, some LCSSP funding, the EHCY funding, which is our homeless, fostering youth, some of those grants that we have here in our district. Next slide. Again, then these are just very quickly, in a minute, you'll see a kind of a chart that will kind of help you better understand, but we also do the managed care billing, BHRS, the CYBHI, the wellness coach grants. Next slide. Community school grants. We have 2 community school grants that we definitely leverage here in our district. They're both at the high school level. So with ELOP funding, we're now tapping into 2 high schools currently to see what a programming would look like there. We also have the Learning Recovery Emergency Block Grant, title funds, and then supplemental concentration funds that we also leverage on. Next slide. So this is a kind of a chart just as a visual when we talk about blending, braiding, and leveraging. So as you can see, the very top, the ELOP, the LCSSPs, all those are the different grants that we leverage. And then down on your right-hand side, the SAS, which is the Student Assistant Specialist. All of these are the different programs, and it'll tell you what funding sources we use to leverage and braid to really continue providing the services that we have here in our district. Next slide. And again, just really quick, an example of threading funds. We talked about mental health clinicians. Some of the cost is 40% for Modesto City Schools. We've had the opportunity to increase mental health clinicians from a 10.5 FTE to 28, utilizing all the different funding sources. So when we talk about coming a long ways from just ACE's money to the ELOP and how we're trying to be creative to really leverage the funds, I think it's important to note that we've definitely had the opportunity to increase some FTEs. Next slide. Thank you. And again, for us, some of the next steps that we're really working on is the new initiative, the billing of counselors and nurses. Liz and Jeff have talked about the wellness coaches. So that's something that we're also looking at our current expanded learning staff and who qualifies to become a wellness coach. So that's something that's in the works. Community grants implementation, currently trying to hire some social workers at the high school level. And we're really looking at bringing in some wellness or expanded learning centers. Of course, those are just some next steps that we currently have in our district. Next slide. So again, thank you. Hopefully this was helpful for all of you, and really what I really want to drive home, and again, is really the braiding and the leveraging of funds to really sustain the programs that we have, and how do we continue to do that at our districts. So thank you. And I'll pass it over to Donielle.
Okay.
Thank you, Donielle.
Thank you, Araceli and Liz, for showing us how it can be done. And I love the point you were making about a lot of the innovation and bringing this together happens because all these different initiatives are together and you're already a team, so it helps you innovate. So with that great example, next we'll kind of walk through what are some first steps folks can take to begin to build out a school-based mental health program that links the school day to the expanded learning program and offering these services all day, all year. What could that look like? What are some first questions you can ask of yourself at the school and district level? So we'll go to the next slide. So expanded learning is a space where initiatives interconnect that Araceli and Liz showed us how that works. And by interconnecting the initiatives, we can help strengthen their collective impact. And expanded learning is a part of that system and a space that helps that happen. So one of the recommendations is to think about accessing multiple county-based TA structures, which helps build the overall capacity building for supporting young people's mental and emotional well-being. So, and thinking about what that statewide system of support looks like, you have expanded learning, the community schools, capacity grants. When you hear that term, it's building the infrastructure for being able to bill for those services, the statewide multi-payer fee schedule. Many are already familiar with the multi-tiered system of support known as MTSS, a framework for thinking about how to meet a student's needs on different levels. And then the overall California system of support. Each of these initiatives have ways of building the capacity of staff and learning. And so altogether, you create a very robust, it ends up being for the student, they have access to a robust school-based mental health infrastructure. And we'll go on to the next slide. You've already heard a little bit now about wellness coaches, and for some, you've heard about it before. For others, it's still kind of new, and you might want more information about it. There's some links to where you can learn everything about it on the HCI website. But one step in the process when you think about what your next steps might be are certifying qualified expanded learning staff as wellness coaches. And you can see we've put, you can learn more about it on the website, but we've put the initial criteria. Right now, Individuals can self-certify when they have either an associate's degree and 6 months experience, or they can certify as a wellness coach 1. And if they have a bachelor's degree and 1 year of experience, they can certify as a wellness coach 2. And right now, the certification process is for self-certification according to those criteria is very simple and quick. Like it usually happens within 1 week, if not the same day. So if you're considering this step, you probably want to get on it before there starts to be a backlog. Because right now, I was in another presentation where I heard we have 3,000 now. And so it's increasing, but right now is a good time to take the opportunity to self-certify those who are already qualified. And upcoming, there will be ways for people to follow. If they don't already possess those criteria, there's an educational pathway that people can take to become certified as wellness coaches. So we'll go to the next slide. Um, so another way, when you think about accessing the countywide TA structures, uh, both having the skills needed to be an effective wellness coach and being able to recertify after 2 years. Expanded learning programs and other initiatives already have built-in ways of capacity building for staff. And so as you're thinking about what does it take to sustain, you're often thinking about how do I, get them certified? How do we fund it? But also, how do we keep those skills up and be able to translate them into activities that can be built? And so, thinking just about what are the structures you already have in place that you've already built out, the professional development. And these are some questions to consider here on the slides. So just the overall quality and CQI in expanded learning, there's foundations in youth development, the science of learning and development, the specific professional development around supporting emotional well-being, such as trauma-informed training, mental health first aid. There's some opportunity to do, there's all kinds of screening, but there's some opportunity where wellness coaches can help assess like what our students needs and what kinds of activities could best support them. So one of the things you might want to consider are the tools and resources and procedures that are already available in your school district system. Um, and then thinking about the navigation pathways. When you think about that multi-tiered system of support, that framework kind of gives you an idea. Some students need support on one level and some need more intensive services. And so what is the navigation pathway? Wellness coaches can be an important part of helping. They're not providing specific clinical services, but they can be an important resource for figuring out who needs what and when. And then fundable, just tapping into that. There's a structure for billing, but tapping into what does that mean on a technical level? How do you document the activities so that they can be turned into claims, which end up funding continuing funding the programs? So we'll go to the next slide. Another consideration, and you saw some examples of this in the example we just heard, as you think about how the co-location aspect. So expanded learning is all year, all day. So there's additional space to not just have expanded learning staff and wellness coaches offering activities that meet students' emotional well-being needs, but those kind of higher level clinical, they might need one-on-one counseling or those kinds of services. Expanded learning is a time where more kids can have access to that because there's more space. And so thinking about the structure of how to do that and co-locate, and also how to create the structures that are necessary to do the technical parts of billing. Thinking about also how to Araceli just addressed this really, really well with a lot of visuals to understand how they do it in Modesto, but leveraging expanded learning funding and each of those initiatives, the fee schedule, MTSS, and community schools for a long-term sustainable strategy. And another one we want to consider any initiative, how that can help support a goal of increasing young people's access to mental and behavioral health supports. One of those is also AB 2083, where counties are already trying to figure out how to work together to specifically meet the needs of foster youth. But in the process, they are developing ways of working together that can make that navigation part a lot more seamless. And so we'll go on to the next slide. Some additional considerations to think about as you think about what your plan would be is um, Araceli described how the different initiatives are already working together. They're already a team. So thinking about if you don't physically have that same structure, how can the expanded learning program be integrated into the coordination of services teams at your school and other school site groups that focus on student wellness? So you could have that synergy. What conversations might need to happen with labor groups as you're rethinking how you're using your workforce. Um, and then again, mentioning the technical aspects of um, making sure that there are activities. A lot of times you're going to find the activities you're already doing in expanded learning could be billable, but it's a matter of having a process so that you can document that and make sure that the actual billing happens. And then, as already mentioned, how do you think about how to make those all the tiers of different clinical services available and families know that they're there to access all year long? How do you build that, and how do you communicate about it? And we'll go to the next slide. As I mentioned earlier, there's so much going on with the Children and Youth Behavioral Health Initiative. And one of the things is they're actually building resources directly that can help support young people's mental and behavioral needs. And so that you see some right there on your screen. And at the bottom, there's a web page that goes to the CAN website, where we'll continue to update as we learn about them. There's already more than you see on this slide. And there's just specific resources that help with you help people identify resources that can directly help with emotional, mental, behavioral, emotional needs. And we'll go on to the next slide. And it looks like I'll turn it over to Jeff.
Thanks, team. And we are making our way here to breakout spaces. But before we do that, wanting to just sort of give an opportunity for reflection. And so where have we been today, right? We've learned about this big statewide vision of increased integration between education, health, and human services. We've considered expanded learning as a platform for that integration, especially to increase access to school-based mental health services. We've learned about a local example from Modesto City Schools that got into the real technical aspects of how they did this through a braided funding model and a district CBO partnership. And we've considered some strategies and recommendations for expanded learning, including, right, sharing these resources that are available to kids and families, right? We know that expanded learning is a great way to communicate with kids and families because the kids are in the program, and the families are interacting with the program daily. So how to create strategies to disseminate those resources and increase access to those resources to kids and families through leveraging and partnering with the expanded learning program. Um, how can expanded learning programs connect to right their capacity grants and those within their districts that are learning about billing, right? And to begin those conversations. Sherilyn, I saw the reflection, wow, I'm in those conversations. Perhaps we should be exploring expanded learning more in those conversations, right? and then looking at how you sort of look at the wellness coach framework of certifying existing staff, building their capacity, and especially, right, then helping them understand how to implement fundable activities and then record their time so that those funding, those opportunities can be braided. And then there's lots of supervisory structures, right, that will need to shift. Not saying that any of these things are easy, right? And then so uh, in moving to into the complexity of this more integrated world, there's lots of support that can be accessed, right? So we talked about accessing integrated TA structures through the County Office of Ed. And then we talked about enhancing this practice through broader county partnerships, right, that are also taking place in the AB 2083 sort of conversations of all the county services, including county public health, right, and uh, juvenile probation and things of that nature, right? Or this is a place where all those county services come together. So how do you leverage that space to broaden your partnerships in implementation? So lots of things that were shared. We want to give you a moment to reflect on some of these things. And this is specifically like what's something that resonated with you, looking at what you're wondering about. We've got a link in the Padlet. We actually have 9 minutes for y'all to engage in the Padlet. And as we sort of surface some of these things that you might wonder about, perhaps we can address some of those things in the space here as we learn some of your wonderings as you've considered this presentation. And then sort of thinking, right, you have this opportunity to reflect, what might I do, right, based on what I learned today, and then anything else that's sort of coming up for you. There's a space for all of that in the Padlet. So I'm going to stop talking now and give you an opportunity to engage in that Padlet. Ask my colleagues to perhaps play a little bit of that thinking music, and we can create just a little bit of space for reflection for you. I know that there's a lot of content that was shared. So looking forward to that reflection time. Team, it looks like Padlet 2 needs to be offered permission for folks to be able to offer some data in the Padlet itself. And continue to reflect on what those questions are while we update those permissions. And team, it looks like from our perspective, it looks public. Are folks clicking the big orange plus sign in the bottom right corner? And yeah, so in the bottom right corner, there should be a plus sign in the Padlet. And how about this, y'all? We got a couple more minutes, but if you have not been able to add a question or reflection in the Padlet, please go ahead and offer that in the chat. All right, team. Let's just go ahead and use the chat. If you've got something to say it there. If you've got a question to ask it there. And if you have any answers to any of those questions, and yep, looking definitely looks like a lot of intrigue about the wellness coach opportunity, and noting also that that website that was shared has some information on how to access. And it looks like permissions are changed on the Padlet, but we have 3 minutes, so let's just continue with our chat-based strategy. And some reflection on what counties are learning. Yeah, Sherilyn, the braid, being able to create that level of sustainability, and how they've been able to grow the FTEs of their clinicians, right? And then hence increasing access for their students is really inspiring. And I would say that counties have been on the journey, a very similar journey to us in expanded learning, where when ELOP came out, it was like, what are the rules? What are the rules? What are the rules? What are the rules? And, some of the things that sounds like in that space is like, what are the qualifications of the electronic health records that I need to partner with in order to record the data so that I can bill accurately, but maintain HIPAA and FERPA data privacy, and right, like, so there's all this, like, what are the rules? But I feel like people are now getting to this point of rounding the corner, saying, like, I feel like I'm getting a handle on the rules. So how do I build on this platform to actually do this well? It seems like that would be how I would describe where we are as a statewide system there. Robin has a question about how wellness coaches connect with school social workers, right? That's all going to be a local structural decision. So one of the things that we're offering is this there is usually something that could be named differently, but it's some sort of coordination of services team on a school campus. Sometimes the expanded learning program is part of those teams. Sometimes they're not. Sometimes there's a connection between those teams and expanded learning. Sometimes they're not. Our recommendation, of course, would be that expanded learning is part of that partnership, and that the wellness coaches are plugged in to that structure. Yeah, and so the certification of a wellness coach is, it does not sort of change their position within a school district. The certification essentially certifies them to provide services and to bill for those services, whether that's Medi-Cal or managed care plans. And that can be individual, but it can also be group. So thinking about when expanded learning programs do a culinary workshop that focuses on nutrition, that could be billable. When you're bringing together a group of kids and talking about the importance of physical activity, or doing restorative circles or social emotional circles, right? These things are things that happen already in programs often, but if conducted by a certified wellness coach, can then be billed, right? So now you have an FTE that's sometimes behind the scenes billed by expanded learning, sometimes behind the scenes being billed by Medi-Cal or managed care through this process. And right through the reimbursement process, this creates revenue for the district that then can be reinvested into these strategies, like community schools. So, looking forward to exploring some of these. This is a really good question that Maria offers, right? Now we're talking about integration, right? For looking at the language skills that are applied through a certified wellness coach as well. So that's some creative thinking, Maria, that I had not considered. Um, so, uh, so with all of that, thank you for taking just a moment, right? Reflection is an important part of the learning process, right? So just having a minute to like have this waterfall of information, but then really getting a chance to process it. And I love the notion, especially around what's resonating with folks and what folks feel like they want to act on. So hopefully, right, apologies for the technical challenges, but hopefully we are able to act on some of that reflection as well. And so we are now going to move into kind of the final portion of our Fall Academy. And I'm going to turn it over to Vanessa to get us ready to wrap and then head into our breakout spaces.
Thanks so much, Jeff. And let's give it up and thank our presenters today. So in the chat, a waterfall of gratitude or a reaction to Donielle, Jeff Davis, Araceli Corral, and Liz Elizondo. Thank you so much for offering your wisdom today. Look at all the love coming through. Let that wash over you. All right, as a reminder, we have a system of support for expanded learning, and they are here to support you. So if you're interested, please, take a picture of that QR code or tap on the chat to open up where and who your contacts are for this system of support. As a reminder, get connected, and here's all kinds of cool ways you can do that. Tap into the one that feels good for you. And if we're going to the next slide, we have a calendar of events. So if you're interested in what's going on in the summer, fall, winter, or spring, please, take a picture of that bit.ly, click on the link, and stay up to date with us. And again, thank you all for your participation. Reflection is really important for us. We're big quality improvement people. So if you can please scan that bit.ly and give us your feedback so that we can sit with it and make the necessary intentional adaptations for our next space. Love is still coming through the chat. All right, so as a reminder, we're moving into our breakout section. It's a choose your own adventure. So tap into, after listening to all that amazing information, what do you want to dive deeper with your peers? As a reminder, these are informal discussion spaces. There's no PowerPoint. We're just there to talk and elevate questions and thoughts. They're not recorded. Our breakout rooms are room number 1, program quality and conditions for learning with the one and only Jeff Davis. Room 2, more about CYBHI, wellness coaches, etc. with Donielle Prince. Room 3, learning from our LEA example with Modesto City Schools districts with Araceli and Liz. and room 4 is school-based mental health as part of a broader ecosystem initiative, which is the ecosystem plan that we talked about in the very beginning, and that's with me. All right, y'all. So I think I hand it over to Melissa. Do I talk about this, Melissa? Ways to join the breakout room. That's a slide there that kind of helps us do that. The breakout rooms will be opening shortly. So if you need some reminders on how to get into a breakout room, you can use this slide or you can message Nat in the chat. Again, Nat is our chat support and they can help put you in a breakout room if you're having trouble.
All right, opening breakout rooms now. Enjoy, everyone.